Hi, my name is Mana Velez, and this is my clinical reflection video for 335. The purpose of this video is to discuss the objectives that were met in this semester. So the first objective is utilize previous knowledge of the science, liberal arts, informational technologies, and nursing to develop skills as a nurse leader. So I do want to talk about the peer leadership experience that I did have. I went to 311 and I helped the junior class with blood pressure checks. We talked about how to perform blood pressure, the different cuffs and how it affects blood pressure results, how to check for pulse, and how to use the stethoscope correctly. I also participated in 321, where I went to St. Luke's Hospital and helped the junior class give injections. They had the opportunity to give COVID injections in the unit. So I discussed the 5 rights of giving medication, the technique to use to give medication, and also what to expect afterwards, or what other things you can expect. The second objective is apply the basic principle of ethics and management to meet the challenge of an ever-changing healthcare environment. So I want to talk about my community and experience. I went to Central Elementary School, who I met Megan. She was the coordinator. We discussed some ethical dilemmas related to the parents in the school. There was miscommunication with parents and teachers. So one of the things are that parents feel like there's not enough resources for them to use, and they are Spanish speaking primarily. So Megan was discussing how they're trying to give information to the parents and let them know that there are resources out there for them, including opportunities for GED. And giving out coats and clothes for the children who don't have it as well. Also, she discussed the lack of diagnosis for children who are having learning disabilities. So she stated that it's hard to make a plan with a parent and so that their children can definitely have a better learning experience. Additionally, I want to talk about the Lehigh County Jail. I went to the jail and went around with the nurse for a detox clinic. So we gave detox medication to those who were detoxing from drugs. So they were stating how they were dealing with patients who were upset and they had a nasty attitude. And some nurses would turn around and give them a second chance and give them their medication that they needed, but some nurses did not tolerate that. The type of behavior. So there are some ethical issues going on as well. Objective number 3 is demonstrate leadership skills through effective use of communication by representing self, the college, and nursing a professional manner. So for this, I did send out emails to facilities and to the coordinators. I did discuss who I am, where I'm coming from, the school, and what the outcome is for my leadership experience as well. So we did talk about initiating some time and date and locations that would be perfect for both of us. At the end of that, or the experience, I did send out thank you emails to those who I had contact with and information from them as well. I want to talk about college leadership. I'm sorry, college scholarship day. The high school students came to the school and had a tour. So they did go to the simulation room where I talked to them about my simulation experience, how the school manages the simulation experience, and what I expected, and what to expect when they start going to school as well. I did talk about the curriculum as well and my clinical experience, and what I found was very helpful and my favorite experience as well. Objective number 4 talks about critically evaluate and disseminate current research related to principles of leadership and the effects on healthcare system. So for this objective, I did have a research article about leadership. The article is Importance of Leadership Style Towards Quality of Care Measures in Healthcare. So basically, the purpose of it was to identify association between leadership styles with the healthcare quality measures. So as we all know, leadership is definitely important. and it's associated with patient satisfaction, and it reduces adverse effect on patients as well. And not only patient, but it increases staff stability and it reduces turnout with staff as well. So just to briefly give a result on the article, they stated that resonant leadership style was related to lower 30 days mortality. Additionally, former leadership style was positively associated with learning from minor and moderate patient safety events. So, just to bring it back to Sullivan book, he describes formal leadership as a nurse with legitimate authority confirmed by the organization and described in a job description. And this will be talked about, like I said, in my clinical experience with my clinical professor. Objective number 5 is function as a competent patient advocate, nurse advocate, and change agent. So I want to talk about the ANA Code of Ethics. Provision 2 states the nurse primarily commitment is to the patient, whether individual, family, group, community, or population. And this correlates with one of my experience, well, both. Tipping the scale was a movie premiere that I went to, and it discusses advocating for patients who in the community who are addicted to drugs. So what they did was they provide shelters, free haircuts, syringes, masks, Narcans. They gave all these supplies to that are out in the streets and they don't have much. And they also recovery. Everybody is definitely important. So that was a great premiere as well. And I also want to talk about the PA Coalition webinar. It was about LGBTQ plus community. So they talked about and they advocated for the LGBT community. They talked about how they want how to take care of that community and how healthcare is evolving to represent the community and allowing them to be cared for in a respective manner. Objective number 6 is talking about formulate plan for continued personal leadership growth and development as an independent practitioner of nursing and contributing member of society. So one of my favorite experiences actually was nurse supervisor, and this is where I would talk about it. So the nurse supervisor, one of the ladies named Heather, very, very, very nice. She showed an important leadership role and she had a relationship with the nurses in the unit and she guided them and with problem solving and gave them help when they needed and made sure that every floor and every nurse knows that they're available when needed. So that was a great experience that I wanted to share, and I feel that this brought a personal growth of mine as a nurse. Additionally, I want to talk about the advanced practice. I had the opportunity to go to the OR and I talked to the anesthesiologist, which was very, very, very interesting. He talked about his transition from being a nurse to anesthesiologist and how it changes perspective and talked about how blood pressure is definitely important and pulse is important, oxygen is important. All of that is important in general, but when it comes to surgery, it's super important. So they have a huge role. And additionally, he was also training one of the alumni at Cedar Crest. She is currently in school for anesthesiologist. So he was allowing her, giving her that space to perform the test that needed performing as an anesthesiologist, but he also made her aware that he was there for her and he's going to guide her and he won't let her fail at all. So, objective number 7 is recognize the role of the nurse in policy making related to healthcare services at local, state, national, and global levels. So, for this, I felt like met the objective when I went to Saucon Valley School District school board meeting. They talked about policies of masks in school and the school district and how that affected the students and the staff. Um, in correlation, I also felt that I had a firsthand look when I was doing my community experience in the Central Elementary School. The students didn't want to wear the mask. They had trouble keeping their masks on or taking their masks off, and teachers were having trouble communicating as well. They felt like they had to put their mask down. So I understood the aspects of the teachers, and then I had the opportunity to see how the school district and what their opinions are. So I saw both of the sides of that aspect. Lastly, I want to talk about objective number 8. So it predicts predict and describe potential ethical dilemma within clinical, organizational, and professional nursing practice. So for this, I want to talk about another article that I do have. It's called Obstacles and Problems of Ethical Leadership from the Perspective of a Nursing Leader. So, again, like I spoke, leaders are definitely important. They must strive to model and support ethical performances, but at the same time, they must be sensitive to moral issues and enhance performances in nursing by fostering respect. Leaders, you want the leaders to empower nurses and have them express their concerns and provide feedback and recommendation. You want to have that relationship. So I want to give an example. One nursing leader said that um, they were trying to behave in a certain manner and pay attention to issues and be kind, but their colleagues had a different perspective and they took advantage of their kindness. So they felt, why would I be so kind and um, reach out when they weren't respecting them back. So they were having ethical issues regarding that. Another example was a nurse leader had to put somebody in charge that they didn't want to and they didn't trust. But the only reason why they put him as in charge was because they didn't have any staff. So they're only filling in the spots. So there was a lot of ethical issues regarding that that leaders talked about in this article. So the result of it is that obstacles such as organizational policies and rules, lack of support from superior, and lack of sufficient and quality manpower will weaken leaders' capability to perform ethical acts and create ethical distress. And lastly, I want to talk about my patient logistic experience. I met with Tyler, who was very wonderful, and he discussed the ethical dilemmas of the next of kin. He talks to the morgue and deals with patients who are deceased and the transferring, but he discussed also the ethical dilemmas of families having disagreements and spouses and how he deals with that situation. So it definitely was a great experience. So those are all of my objectives and how I met the objectives. Overall, I felt like I had a great experience, and I learned so much from everybody. I just want to thank you, and I used all my resources from the ANA, Sullivan, and my 2 articles. Thank you.